Thank you to both moderator, Aslina and Navin Kumar for the kind introduction. Assalamualaikum and very good afternoon to all participants and delegates of DAR, Diabetes and Ramadan International Alliance Conference 2024, Asia edition. I think this is a very important topic to discuss, often overlooked by clinicians and healthcare providers in the care of their diabetic patients. And suddenly we realize that Ramadan is knocking on our door. And I think it's timely for us to talk about this as we enter the month of Rajab and Ramadan is just a few months away. Now, I would like to take this opportunity to thank the organizer, the organizing committee for inviting me to share and give some thoughts in the role of medical societies in helping people with diabetes in Ramadan. So this is the outline that I would like to cover in the next 15 minutes, the role and support of society towards people with diabetes and the society units that is involved in the diabetic care and what are the medical society available and focusing on Diabetes Malaysia, and what are the activities and services provided by Diabetes Malaysia in supporting people with diabetes during Ramadan. Right. So there's a lot of issues related to Ramadan faced by diabetic patients. And the one concern or the biggest concern that they have is whether they are fit to fast or not. So this is the big question. And they are worried about the complication or going into hypoglycemia or even hyperglycemia during fasting, and whether they can get dehydration, and that may lead into diabetic ketoacidosis. And most of people with diabetes also have a bit of confusion and unsure about how to adjust their medication, especially those who are on insulin regime. And of course, during fasting month, food is the focus, and this often lead them to not adhere to the proper dietary intake. So they need some guide on the dietary intake, the amount and the timing as well. And when it comes to physical exercise, most of our diabetic patients tend to stop doing physical exercise during Ramadan. And this also will have some impact on their diabetic control. So who are responsible actually to help or assist people with diabetes during Ramadan? Of course, the healthcare providers. On top of that, there are other units in the community should also support along to help them to be able to fast safely. For example, their friends, their circle of friends, their family members, the colleagues at work, and in children, of course, their teachers in the school. And also there are NGOs in the community or in the society that also can support and help them along the way. So the role of society is actually, we're supposed to support and help people with diabetes so that they are able to fast like other normal people and to prevent them from ending up with complication during Ramadan. And we're also supposed to create conducive environment in order to support their food intake, their exercise, their medication, so that the environment also is conducive for them to be able to fast. And not forgetting also to avoid stigma among diabetic, because often in those who are not fit to fast during fasting month, they will feel frustrated, they will feel stigmatized and guilt. So we're supposed to make them understand and support them that why they are not fit to and it's okay to not fast if they are not fit. So who are the people who are responsible to help people with diabetes? usually most of the time their own family doctors or nurses where they get treatment for their diabetes. So those they will get the advice from their doctors and nurses. On top of that, I think there are also other paramedics or the primary healthcare team that can also assist them. For example, the diabetic educators that was shared earlier by the earlier speaker, and also pharmacists, dietitian. So all this actually helps them to understand better and able to guide them along during the fasting month. Not forgetting about family members as well, because their spouse or their children, especially in the elderly, need a lot of support from their family members. And the family members also were able to assist them to adhere to all the advices and the treatment planned by the healthcare providers. And I think the religious teachers, like Imam in the masjid or in the community, should also tell them if and re-emphasize if they are not fit to fast, and it's okay because there is exceptions because of their health condition. And when they get endorsed by these religious teachers, then they feel more confident and they don't feel frustrated. And they can actually replace their fast at other time when their diabetic control are much better. Not forgetting food sellers and retailers. So usually in fasting month, most of the time we break fast there's a trend to break fast in mosque. And also, there's a lot of food sellers. There's a lot of buffet in the hotels. So they should also think about what are the needs of diabetic patients and try to have a option or a corner where people with diabetes can have a better option of food intake. And talking about medical societies, the one that I'm going to focus in my talk, also have a role to play because often in the community or in the society, they also they can also get assistance or help besides from their clinics and hospitals. So these are the example of medical societies available in Malaysia. For example, Diabetes Malaysia, where I'm attached to. And we also have National Diabetes Institute, NADI. And the other one is Malaysian Diabetes Educators Society, MDES. And these are the three main medical society available in Malaysia. Of course, Diabetes Malaysia is the one which is very much established and work closely with diabetic patients, whereas National Diabetic Institute focusing more towards coming up with a program for diabetic patients, doing research and publication as such. And for Malaysian Diabetic Educators Society, focusing more on the need for the diabetic educators themselves, the training. Indirectly, actually, it also help in the care of patients with diabetes. We also have support groups from the social media. There's a lot of this type of support group available, like Club Diabetes Malaysia or Fight Diabetes. I'm sure there's more than that, where usually they can easily get access to and to get information and guide. Yeah. So let's talk about Diabetes Malaysia, because this is the one that is established in Malaysia more than 40 years now, since 1981. It's a non-profit, non-governmental organization, and this is established to help people with diabetes to lead healthy and productive lives. So we have expanded so much that we have now 14 state branches and 37 district branches throughout Malaysia, including Sabah and Sarawak in the Borneo. And with all these branches, people with diabetes have easy access to Diabetes Malaysia to get information or to get for the resource that they need. And as for now, as to date, we have more than 12,000 registered members throughout Malaysia. And the activities that we carried out usually in the form of seminars, forums, workshops, health screenings, and camps. And this is done throughout all branches as well. And our vision is we lead the fight against diabetes in Malaysia, and the mission is to promote diabetes care through awareness, prevention, education, and management. And the objective of Diabetes Malaysia is to provide support for the needy diabetics, irrespective of race, religion, and creed, in managing their diabetes and related complications. We also educate the community in the prevention and management of diabetes through classes, newsletters, and the other activities that I mentioned earlier. And we also assist members of Diabetes Malaysia to acquire discounted monitoring items, devices, and diabetic products. And we also do organize support group gatherings for the members to share their experience in managing diabetes with others and update them on the latest diabetes health issues that the camp that we had. So for Ramadan, we have specific activities and services provided to help diabetic patient to prepare better for Ramadan. For example, health talks, usually in the topic of diabetes in fasting month. We also conduct personalized counseling. We provide guidebook and booklets for monitoring of their diabetes at home, and also healthy cooking and menu for fasting month. Usually they will like this very much. And also providing food replacement and supplement by the sponsors. And some branches also do organize breakfast, iftar, with the members of Diabetes Malaysia. So this is the example of the talk that we have organized before. Usually this is done in our center or in the branches, as well as in the community hall. Usually we'll invite the endocrinologists from the hospital to share and to give the talk, not only to the members, also to the and also open to the public, and it's free of charge. Usually we organize this talk earlier, probably around 1 month or 2 months before Ramadan. And together with the health talk, we also conduct health screening pre-Ramadan to create awareness, as well as to get the other family members to understand what are the needs of their family members with diabetes in Ramadan. Right, this is the counseling session that we had in our center. So it's a personalized counseling where they can come, and usually they will book an appointment to meet our diabetic educators or the diabetic nurse. So usually during the counseling, we will cover what are the areas that they are not sure, that they need to clarify, because usually in the hospital or in the clinics, the doctor could have explained it in a rushed manner, then they were not able to grasp. So during the counseling session, they can ask us further, and we can guide them through and give them also advice on specific areas, for example, their medication, their diet, as well as the exercise. And this is some of the example of the reading materials that we provide to our members, so they can take home and read for their to guide them, also for their reference, regards to how to monitor their sugar, how to take their meal, the timing, and also some guide on recipe on how to cook their meals during Ramadan. This is the one that I mentioned earlier about the food replacement and supplement. And this is dietary support in Ramadan. Usually in Ramadan, they tend to skip the morning meal, the sahur, and they maybe just take a small meal, and that will put them at risk for hypoglycemia. So with this nutrient or food replacement, that will help to prevent hypoglycemia.